The moment your foot catches on an uneven sidewalk and that sickening lurch hits your stomach, everything changes. Your arms shoot out, your heart races, and for a split second you realize your body is no longer automatically protecting you. That feeling lives in the bones of so many people over 65. It is not just a stumble. It is the quiet thief that slowly steals your independence, your daily walks, your spontaneous trips to the grocery store, and the joy of chasing a grandchild across the grass. I have watched this fear take root in my patients for years. What begins as a single near miss becomes hesitation at the top of stairs, then avoidance of evening outings, then fewer trips outside the house altogether. The less you move, the worse your balance becomes, and the cycle tightens until one day a simple fall can land you in a hospital bed with a fractured hip and a very different future than the one you planned. You do not have to accept this as normal aging. Your balance is not a fixed trait that disappears on schedule. It is a trainable skill built on 3 sensory systems that can be sharpened at any age. The simple daily practice I'm about to share with you directly strengthens the exact systems that keep you upright when life throws you a curve. It takes 3 to 4 minutes. You can do it in your kitchen while the coffee brews, and the results compound faster than most people expect. Your balance system is an elegant conversation between your eyes, your inner ear, and your proprioceptors. When all 3 speak clearly and quickly to your brain, you stay steady. When the signal weakens with age, the conversation gets fuzzy and you start to wobble. Let us look at each piece closely so you understand exactly what we are training. Your vision does far more than help you see the sidewalk. It provides constant data about speed, depth, and surface changes. As we get older, contrast sensitivity drops, depth perception becomes less accurate, and our pupils react more slowly in changing light. That is why so many people feel unsteady moving from a bright kitchen into a dimly lit hallway. The brain suddenly loses high-quality visual information and has to rely more heavily on the other 2 systems. Your vestibular system, deep inside the inner ear, acts as a biological accelerometer. Tiny hair cells and 3 semicircular canals detect every tilt and rotation of your head. With age, those hair cells gradually decline in number and sensitivity. Certain medications commonly taken by older adults, especially blood pressure medicines and sedatives, can dampen this system even further. The result is that familiar feeling that the room shifted slightly when you turned your head too quickly in the grocery aisle. But the real hero and the most neglected piece is proprioception. These specialized nerve endings in your muscles, tendons, and joints tell your brain exactly where every part of your body is in space without you having to look. The soles of your feet contain thousands of these sensors that read the texture and angle of the ground. Your ankles have receptors that detect the tiniest shift in weight. When these signals slow down or become less precise, which commonly happens after 65, your brain receives delayed or incomplete information. The tiny corrective movements that used to happen automatically now arrive a fraction of a second too late. That delay is what turns a minor trip into a fall. This is why simply lifting weights often fails to solve the problem. Strong legs are useful once you start to fall, but they cannot prevent the loss of balance if your brain does not know you are falling in time. The high-quality evidence is clear on this point. A major systematic review of 116 randomized trials involving more than 25,000 participants showed that general exercise reduces falls by 23%. When the program specifically emphasizes balance and functional training, that number rises to 24%. Programs that included at least 3 hours per week of balance work achieved a 42% reduction in falls. Strength training alone without a balance component has not shown meaningful impact as a standalone intervention. These are not fringe findings. This is high certainty evidence we can trust. The single leg balance stand is the most direct way to train exactly what the research shows works. When you stand on one leg, even for 10 seconds, you force your ankle proprioceptors to fire rapidly. You challenge your vestibular system to keep your head level. You train the visual system to look forward instead of down. Most importantly, you teach your brain to integrate all 3 inputs faster. Every wobble is a conversation between your nervous system and your muscles. The more conversations you have, the clearer the signal becomes. Here is exactly how to do it safely and effectively. Stand directly behind a sturdy kitchen chair or counter that will not move. Place your hands lightly on the back of the chair. Shift your weight onto your right leg, then slowly lift your left foot just an inch or 2 off the ground. Keep your left knee slightly bent so you're not locking anything. Look at a spot on the wall straight ahead at eye level. This keeps your vestibular and visual systems working together naturally. You will immediately feel the small muscles around your ankle and foot working hard. That is the point. Those are the exact muscles and sensors that need strengthening. Breathe normally. Many people hold their breath when they feel unstable, which actually makes balance harder because it increases tension in the upper body. Hold for as long as you can maintain control, even if that is only 5 seconds at first. The goal is quality, not quantity. When you feel yourself losing control, gently place the foot back down. Rest for a few seconds, then repeat on the same leg before switching sides. Complete 2 to 3 holds on each leg. This entire sequence takes 3 to 4 minutes. Do it every single day. The research is clear that daily practice produces better results than longer sessions done 2 or 3 times a week because it keeps the neural pathways active and responsive. During the first 2 weeks, most people notice 2 things. The wobble is larger than they expected, and 10 seconds feels like a long time. Both are normal and both are temporary. The wobble is your system waking up. Each day, the amplitude of that wobble decreases as your proprioceptors become more sensitive and your brain processes the signals faster. By week 3 or 4, many patients can hold for 20 seconds with lighter fingertip support. This is when the real transformation begins. The brain is literally rewiring itself through neuroplasticity. Studies using brain imaging show increased activity and better connectivity in the areas responsible for sensory integration after consistent balance training, even in people in their 80s. Let me tell you about Mrs. Tanaka. She came to my clinic at 74 after 2 near falls in her garden. She was already walking 4 days a week and lifting 2-pound weights. Her leg strength was good, yet she felt unsteady every time she turned to look at a flower or reached up to prune a branch. We tested her balance and found her single leg stand time was under 4 seconds on each side with significant swaying. I asked her to do this exact practice while waiting for her morning tea to steep. She started with 5 seconds per side, holding the counter firmly. Within 3 weeks, she was at 15 seconds with 1 finger touching the chair. At 2 months, she could stand on 1 leg for 30 seconds with her eyes open and 10 seconds with her eyes closed. The real victory came when she called me after visiting her granddaughter's house. She had carried her 2-year-old grandson on her hip while walking across an uneven lawn without a single moment of panic. That is the kind of independence this practice restores. I have seen the same pattern with Mr. Yamamoto, a 79-year-old retired engineer who avoided stairs for 2 years after a frightening fall at the train station. His neuropathy in both feet made proprioception even more challenging. We modified the exercise so he began with a wider stance and progressed to narrower foot placement over time. He also practiced standing on 1 leg while brushing his teeth, linking the new habit to an existing one. 6 months later, he was confidently using the stairs in his home without holding the railing the entire time. He told me the greatest gift was no longer feeling like a burden when his family wanted to visit the Japanese garden downtown. Then there is Mrs. Alvarez, 68, who developed a deep fear of falling after watching her sister fracture her hip. She avoided all evening activities because she did not trust her balance in lower light. We combined the single leg stand with simple head turns while balancing to retrain her vestibular system. We also talked about strategic lighting in her home. Within 4 months, she was attending her book club again at night and walking her dog after dinner. The fear did not disappear overnight, but it lost its power over her decisions. These stories are not exceptions. They are the expected outcome when people consistently challenge their balance system in the specific way the research supports. The single leg stand is remarkably effective, but it is not the only tool. Tai Chi offers another evidence-based path that many of my Japanese, American, and Asian patients find especially resonant. This flowing practice trains balance through slow, deliberate weight shifting that perfectly mimics the demands of real life. Multiple large trials have shown Tai Chi reduces fall rates by 23 to 43%, depending on the frequency of practice. It improves proprioception, strengthens the ankles and hips, enhances vestibular function, and lowers fear of falling scores on validated questionnaires. The beauty of Tai Chi is that it also calms the nervous system. Many older adults carry chronic low-level tension from the fear of falling. That tension itself impairs balance by reducing flexibility and slowing reaction time. The mindful breathing and continuous weight transfer in Tai Chi reduce that tension while training the body. If a local senior center offers classes, start there. Many instructors understand the needs of older bodies and will show you modifications. If classes are not accessible, several excellent programs designed specifically for fall prevention are available online and can be done at home. As you progress, you will naturally want to make the single leg stand more challenging. The research shows that gradual progression produces the best results. Here is a practical ladder you can follow. Level 1, both hands on the chair, eyes open, 5 to 10 seconds. Level 2, 1 hand on the chair, eyes open. Level 3, 2 fingers on the chair. Level 4, 1 finger touching. Level 5, no hands, but chair within easy reach. Level 6, eyes closed for 3 to 5 seconds while still near support. Level 7, standing on a folded towel for a softer surface. Level 8, adding small head turns while balancing. Level 9, reaching forward or sideways with one arm while balancing. Level 10, doing the stand while reciting a poem or counting backwards from 20. This last level forces your brain to divide attention, which is exactly what happens in real life when you try to talk while walking. Move up the ladder only when the current level feels solid for 30 seconds on each side. Some days you will feel steadier than others. That is normal. Aging bodies still experience daily fluctuations in hydration, sleep quality, and blood pressure. The key is to show up every day and do what you can with good form. Pay close attention to your body while practicing. Never push through sharp pain in a joint. Mild muscle fatigue is expected and helpful. Sharp pain is a signal to stop and reassess. If you have significant arthritis in your feet or ankles, begin with a shorter hold and consider wearing supportive shoes with good arch support during practice. If you have diabetic neuropathy, the sensory input from your feet is reduced, so you may need to rely more heavily on vision and vestibular input in the beginning. The brain can compensate remarkably well when given consistent training. A few common mistakes can slow your progress. Looking down at your feet is the most frequent one I see. It removes the natural integration of all 3 balance systems and reinforces poor posture. Keep your gaze on the horizon. Another mistake is tensing the shoulders or holding the breath. Stay relaxed through the upper body. Think of a tall, proud posture with soft shoulders. Tension travels down the kinetic chain and makes the ankles work harder than necessary. Many people also underestimate how quickly the fear begins to fade. Within the first month, most of my patients report that the little uncertainties that used to trigger panic, the transition from carpet to hardwood, the moment the dog runs between their legs, no longer spike their heart rate. That reduction in fear is itself a powerful fall prevention tool because it allows you to move more naturally again. Your balance system responds to training the same way your muscles respond to lifting weights. Use it with intention and it grows stronger. Neglect it and it fades. The difference is that balance training also improves something even more valuable than strength. It restores confidence, and confidence is what lets you say yes to life again. I want you to picture your life 6 months from now. You walk into the garden without scanning the ground for every possible hazard. You carry groceries up the front steps without asking for help. You dance at your granddaughter's wedding without worrying about turning too quickly. You sleep better because nighttime trips to the bathroom no longer feel like a dangerous expedition. These are not unrealistic hopes. They are the documented outcomes of consistent balance training in thousands of older adults. The practice is simple, but the commitment must be daily. Link it to something you already do every morning. While the rice cooker is running, while your tea steeps, while you wait for the shower to warm up. 3 minutes every day. That is the prescription. Some of you will notice improvements in areas you did not expect. Better posture, fewer aches in the lower back, because your core stabilizers are working more efficiently. Improved mood from the sense of mastery and control. Many patients tell me they feel younger, not because their chronological age changed, but because their body finally feels reliable again. If you have been avoiding certain activities because of balance concerns, make a list of them now. Keep it visible. As your single leg stand time increases, check off the activities you are willing to try again. This tangible progress tracking keeps motivation high. Your body is still capable of remarkable adaptation. The same neuroplasticity that allows a stroke survivor to relearn walking is available to you for balance. The sensors can become more sensitive. The brain can process signals faster. The muscles that stabilize your ankles can get stronger and quicker. All of this is accessible through the simple act of standing on one leg with intention every single day. I have never met a patient who regretted making this investment. I have met many who wish they had started sooner. The beautiful part is that it is never too late. I have patients in their late 80s who have gone from being unable to stand on one leg for 3 seconds to holding for 20. Their faces when they realize what they can do again are why I keep sharing this message. Take the first step today. Right now, while this is fresh, stand up and try 10 seconds on each leg with your hands on a chair. Feel what happens in your ankles. Notice where your body wants to compensate. That awareness itself is part of the training. Tomorrow, do it again, and the next day. Small daily deposits create a balance account that pays dividends for decades. You deserve to move through your days with confidence instead of caution. You deserve to keep your world large instead of letting it shrink around you. The tools are straightforward. The science is solid. The only thing left is your decision to begin. The fear of falling does not get the final word in your story. You do. Start standing on one leg today and watch how steadily your confidence returns, one mindful second at a time. Have you already noticed certain moments when your balance feels worse? The first steps after getting out of bed, when you turn your head while walking? Tell me in the comments. Your experiences help all of us understand the patterns and find better solutions together. What is one small change you are committing to this week? Maybe it is doing the single leg stand while the coffee brews every morning. Maybe it is finding a Tai Chi class in your area. Share it below. Seeing your commitments reminds everyone in this community that we are not alone in wanting to stay strong, independent, and active for as many years as possible. Your balance is waiting to be reclaimed. The practice is simple, the results are real. Begin today and let each steady moment become another step toward the free, confident life you want to lead.